it was the end of summer and you weren't feeling well. What were the symptoms that led to your initial concerns about your health?
Well, started with a sore throat. After about a week, I went to the doctor, and the doctor prescribed antibiotics. 4 days later, still wasn't getting any better, so we can now rule out strep. Right? Went back to the doctor, and the doctor then said, stop taking the antibiotics, and gave me a steroid pack and some Flonase. About 3 days into the steroid pack, started having a racing heart, and it wasn't coming down. It was like 120, and it wasn't coming down. So I went back to the doctor, who said, stop taking the steroids. Wait a couple days, titrate down, stop taking them, your heart rate should return to normal.
Right.
And it didn't. After I stopped taking them completely, I waited 30 hours, which is how long it takes for them to clear your system, and my heart rate still wasn't returning to normal. It was the middle of the night. I was having trouble sleeping. I was getting up every hour to sort of sit up and reposition myself. So that's when I woke Kevin up and asked him to take me to the emergency room.
Okay, so at this point, clearly we knew something was going on. You went to the ER, tests were run, you got admitted, and eventually the doctors came in with the diagnosis of leukemia. What was your first reaction?
Denial. I asked them, are they sure? You know, how did they know that the white cell count wasn't because of the pneumonia that they diagnosed me with? I think I went through all 5 stages of grief in that one moment. I went through denial. I went through anger. How can this be happening to me? I asked stupid questions. Will I lose my hair? What a stupid question, obviously. And I eventually came around to acceptance, all in that one moment, because we needed to figure out how to move forward.
All right. And since every leukemia case for every individual is unique, what was the treatment plan that you ultimately decided would be the best course for you?
So while I was in the emergency room, they let me know that I would be staying in the hospital for 3 to 4 weeks so that they could immediately start what they call induction chemotherapy. That is, it's called induction because its goal is to induce remission. So that is 7 days of 24-hour chemotherapy. The first 3 days, you get 2 types of chemotherapy. You get one that comes in an IV drip, and you get one that they have in a very large syringe that they push into your IV. And after 7 days, you're done with your chemotherapy, but you have to stay in the hospital because the chemotherapy drops your white cell count, drops your neutrophils, drops your platelet count and your red blood cells. So in order to support you through the recovery from that, they have to give a lot of blood product. So you have to stay in the hospital where they can monitor you for infection, for bleeding, bruising, things like that.
Okay, you were able to come home after your initial treatment. What goals did you have to hit to be able to be released to come home?
My neutrophils had to be on the rise. They didn't have to be in a normal range, but they did have to be higher than what they were, as did my white cells. And my platelets had to be in a reasonable range. Fortunately for me, my platelets shot up incredibly. They were doubling every day, which was somewhat concerning for me and my doctors because they had never seen that before. And in fact, we had a period of time where they weren't sure if that was a sign that the leukemia was still present and I was not in remission, or if it was a robust recovery and I was in remission. So they did another bone marrow biopsy and determined that I was in fact in remission and it was a robust recovery.
There are several types of leukemia. Which kind do you currently have?
I have acute myeloid leukemia. Acute means a sudden onset.
Okay.
My onset was, I would say, about 2 weeks. And then the myeloid is just the type of cells. I also have a FLT3 mutation. Anyone who's familiar with leukemia, we all talk about our different mutations because there are an endless list of mutations that you can have when you have leukemia. And I have a long list of mutations, but the most prominent one is FLT3. FLT3 is the mutation that makes the leukemia recur. So to avoid a recurrence of the leukemia, I have to take a special medication, which is a FLT3 inhibitor. Not sure how long I'll have to take that, but that's 14 days on and 14 days off. So it alternates. It's a form of oral chemotherapy, basically.